Hello everyone, and welcome to a special edition of F.Y.I. Uxbridge. I'm your host, Barry Giles, the station manager and program coordinator here at Uxbridge Community Television. Today we have some special guests to talk about the recent issues with the coronavirus. With me we have Dr. Kristen Black, who is the Uxbridge Health Director, and Chief Marc Montminy.
Close enough.
Close enough? We're going to do that one? Okay, cool. Uxbridge Police Chief, but today he's acting as the Emergency Management Director.
Correct.
So thank you very much for joining us. So big issues today in the health world. We're talking about the coronavirus and so on. I invite you guys on to discuss some of the issues that people in town might be having, or possibly questions that people might have. So first of all, what is the virus?
So the coronavirus, or it's known as the novel coronavirus, is a new virus. It was first detected in Wuhan, China in late December. It's spreading globally, and we're seeing it in the United States as well. The disease that it causes, which is lung infection or respiratory infection, is known as coronavirus 2019, also COVID-19.
Great. Now, I know that a lot of people, especially myself, I'm watching the media and I keep hearing about local towns in Massachusetts that people are having some of the symptoms and things like that. What's the town doing to prepare for this?
Well, the town has formed a couple of close-knit groups that are working on this. We have an executive decision-making group that meets on a weekly basis, and we also meet as a broader group. The department heads meet as a broader group to talk about, make sure we're sharing information and communicating back and forth with each other. And we have a couple of plans that we can put into action at any time. We have a communication plan. We have a pre-infection phase plan and a post. We work very closely, the emergency management, with Board of Health, and Board of Health works very closely with their partners at the state and federal level.
Great. What do people do if they start thinking they might have this coronavirus?
So we would recommend that anyone that would be exhibiting the flu-like symptoms of COVID-19, that they would contact their healthcare professionals for guidance. The important thing with COVID-19 is it's important to call ahead and not to just appear at your doctor's office. They're taking protective action to protect healthcare staff. So again, if you have symptoms that are not life-threatening, we would say that you would contact your healthcare professional, and obviously if you were having difficulty breathing or emergency situation, you would call 911.
Great. And that's what you recommend, Chief? If
you have a serious illness and you call 911, make sure you're specific as to what your symptoms are. Our dispatchers have been trained to recognize these symptoms and report to the first responders so that they can use the appropriate safety measures when they respond.
And how are you getting the information out to the community?
Great question. So on February 27th, we had our first interdepartmental emergency planning team meeting, which Chief just referenced. This group's meeting weekly. We created a website. It's through the Board of Health page. We have a tiny URL link, so it's tinyurl.com/Uxbridge coronavirus. This website is just a place in town where we can have local specific information, but most importantly, we are pointing all our residents to the most reputable sources of information, which in this case is our Mass Department of Public Health, MDPH, or the Center for Disease Control and Prevention, CDC's website. Both of those websites are being maintained either by the state or the federal government. There's daily updates. There's counts on cases and where we're seeing coronavirus in the United States. There's information on prevention and precautions you can take to protect your family. There's also very specific guidance if you have conditions, if you are at greater risk of serious conditions of COVID. There's a new guidance document on that as well. So that would be for older adults or anyone with underlying medical conditions, concurrent conditions, or immunosuppressed, those sort of things.
Great. I know, Chief, one of the systems that we use in town is the Code Red system. You want to talk about that?
Yeah, we understand that information sharing is the most important thing we can do right now, and we want to make sure that people are taking advantage of it. One way to take advantage of that is the Code Red system. Code Red is our reverse 911 system where we can notify residents, but we can only notify you if you are in the system. So for most people who have landlines, they're already in the system, but if you happen to be one of those cell phone only people, you have to register. So we need to know your name and your phone number so that we can contact you during times of emergency. We'd also ask people to sign up for e-alerts on the town website. So the town website is a wealth of information, and we use it as kind of our billboard. This is where we're going to post everything. As things change, as information updates, we're going to post it all there. And if you subscribe to the e-alerts on our website, you'll get notified of those as soon as they hit.
So what can people do to protect themselves from this virus?
So there's a lot of information out there on our website, both on the CDC and the State Mass Department of Public Health page. But ultimately, it's similar to what everyone's pretty familiar with how to prevent the flu. So we want people to take basic measures. And if you're sick, stay home. Also cover your coughs and sneezes, cough into your elbow. Washing your hands more frequently, and again, working with young children especially, that you want to be washing, for at least 20 seconds, scrubbing with a lather. If you don't have access to wash your hand sanitizer can be used as an alternative, but we want you to be using a hand sanitizer that's at least 60% alcohol-based, and so. Again, around the home, it's about proper disinfecting. So looking to disinfect areas at home or workplaces that are your high-touch contact areas, cell phones, door handles, desks, keyboards, and those sort of things. There's guidance on disinfectants through the CDC's webpage. That's all linked off of our town webpage. And it's important that people are using the correct cleaning products for disinfecting against COVID-19. So there's a list of recommended products, and also importantly that people are following manufacturers' directions. So we all know how to clean at home, and you spray the Lysol or the bleach wipe, but if you really read the bottle, it will tell you many products you need to leave on for 10 minutes and let air dry. So really make sure you find an approved EPA product that's known to kill the coronavirus, and then to apply it in accordance with manufacturers' directions.
Okay. Is there anything that people can go to the pharmacy to help take care of this? Anything over the counter or?
Unfortunately, there are no treatments at this time. There is not a vaccine available. So other than the typical Tylenol or flu remedies to just help to ease your symptoms, there really isn't anything specific pharmaceutical that the doctors could prescribe at this time.
Okay, great. Is there anything else you guys want to add? Any other information?
I think we've covered it.
Okay, great. Thank you for joining me on this first segment. On our next segment, we'll have members from the Board of Health. We're going to discuss a little bit more about the coronavirus. Hello and welcome back to F.Y.I. Uxbridge. In this segment, we're going to be talking to two members of the Uxbridge Board of Health. We have Dr. David Tapscott and Dr. Joann Lindenmeyer. Thank you for joining me on this section of the program. Once again, we're talking about the coronavirus. And let's talk about the virus itself. Can you tell us what the virus is like? I'm not saying you have it or anything. I'm just saying.
No, I mean the symptoms.
The symptoms.
Okay, the symptoms, the main symptoms are fever and cough or respiratory symptoms, and a vague sense of fatigue or tiredness. Those are the three main symptoms, and you can get a variety of other symptoms such as sore throat and headache and all that. But fever and cough, I would say, and feeling ill are the main ones.
Okay. And how does this compare to the average flu that most people get?
The symptoms are very similar, so sometimes it's hard to tell the difference. And that's why we urge people to really call their physician and to get some advice from their healthcare provider right away. And you mentioned the flu. It's important to get flu vaccine, which can still be effective. It can cut down on the number of flu infections. And just to put this in a little perspective, the influenza this year has killed over 20,000 people in this country alone. So in terms of causing problems, the influenza is really right up there. This is a new virus, however, the coronavirus, so there's a lot unknown about it as opposed to influenza.
Can I just add that there is no vaccine for coronavirus
Right.
yet.
Right.
We expect there to be one within a year to 18 months. and it looks, at least at this point in time, as though it may be more highly transmissible than the influenza virus. So there are concerns that we have. It's also, as you probably know, we're looking at more cases every day. So we're probably at the beginning of this outbreak in the United States, and we expect to see many more cases.
Great. So what should people do at home to possibly prevent this from happening?
Well, as mentioned on the first segment, if you're ill, you should call your healthcare provider. If you have fever and cough, you should definitely stay home and isolate yourself as much as possible. And probably line up other people to sort of help take care of you. And that includes adults and kids, school-age kids and adults. Those are the main things to do for yourself. And if you're not ill and out in public, it's important to wash your hands frequently. How frequently? It's hard to know. Every half hour, after every hour, with soap and water for at least 20 seconds. You can also sanitize surfaces that other people may have touched, such as countertops and doorknobs and all that, with hand sanitizer or whatever. Now, this speaks directly to small businesses. We've gotten questions from small businesses, what should I do? And I think regular cleaning of those public surfaces, such as tabletops and countertops and doorknobs, with a solution containing bleach, following the instructions on the bleach about how long you leave it in place, or a solution containing 60% alcohol. So those are some things that you can do, and they're the primary line of defense. You really shouldn't rely as much on a new drug, which probably isn't going to come around the corner, or like Joann mentioned, the vaccine, which is not around the corner, maybe months to years in advance. But the primary line of defense is self-isolation and hand washing.
I just want to say, and I agree with everything that David said, self-isolation can be difficult if you're in a small house with a large family. And so we recognize that although that's the recommendation, it may be difficult to actually to employ at home. So people, if they could do the best they can to keep themselves away from other people in their family and of course their pets.
Yeah. Let's talk about some of the supplies. Going to a local CVS or any other store now, you can't find, the Purell or anything else. Let's talk about face masks. People using the surgical masks and anything. Is that recommended, or does that really do anything?
Well, face masks are really only effective if you are symptomatic. So they protect other people from you if you're coughing, sneezing, that kind of thing, but they don't protect but it's not useful for people who have no symptoms at all. It will not protect you by wearing a face mask. It will keep people who are symptomatic from transmitting virus into the environment and to other people.
So should we panic about, I know a lot of people are starting to hoard a lot of this stuff. Yeah. We're all in this together.
Yes, we are.
So if one person's buying 50 bottles of Purell and we get there and there's none left for everyone else, what's the message we should be sending people?
Be frugal with what you buy. I mean, the issue of face masks has come up because they're almost impossible to get. And those especially should be reserved for people who are caring for people who might have coronavirus. Right. For instance, in a home, if someone comes down with symptoms, even if they know whether it's coronavirus or not, the person who's ill should be wearing a face mask. And that really gets into why a face mask is used, gets into the way it's spread. It's spread through droplets. It doesn't go far, far away in the air, but if you cough or sneeze directly on someone and they get it in their eyes, ears, nose, or mouth, then they can get sick. Well, the droplets only go out about that far. So the recommendation is that if someone is actively sick and coughing, you try and stay 6 feet away for your own protection. So those droplets can land on surfaces, and that's why the emphasis is on cleaning surfaces to kill the virus, and cleaning your hands, so in case you've touched the surface with those droplets on it, they'll go down the drain.
And I would also say that if you're hoarding supplies like hand sanitizer and masks and things like that, that you may be keeping those items away from people who really need it. So your point about we're all in this together could not be more true. We are all in this together, and we can't just be looking out for ourselves, because this is a virus that doesn't respect person, place, or thing.
Exactly.
Yeah.
Let's talk about animals. Pets.
Okay.
Can pets contract this?
There has been only one report of a dog in Hong Kong that has the virus in its respiratory epithelium. The problem is that that does not mean that the dog is infected, and that dog probably just has virus in its nasal passages in its throat, the same way it was around someone who had the virus. It's the same reason why virus could be on a table or a countertop. So to date, that dog has not been shown to be infected. There is no evidence to show that dogs can be infected or that dogs can transmit it to people. And in fact, this one case of a dog no doubt got it from a person. But again, I want to stress that that dog was not infected and was not transmitting virus. So there's no evidence to show that that's the case. And people should not be giving up their animals because they're concerned about that. But they should, as David said, they should be isolating at home. They should be isolating from other family members, keeping themselves in a very limited space if they can, keeping away from their pets, just because we don't want to transmit virus on surfaces or on dog fur or anything like that to other people.
Great. Now, you mentioned before, we're just at the beginning of this. It's going to take a while before a vaccine is created for this and so on. I know, watching the news, once again, they were talking about the testing kits being short of that, and they're finally catching up on those things. Do you think people should be anxious about every little thing that they do now, or is it more of a, just be common sense type of thing?
Common sense and really looking at what you do in terms of touching your face, which is a really difficult thing not to do.
Right.
But hand washing, frequent hand washing and cleaning of surfaces and isolating yourself if you're ill are the primary things. And I think paying attention to those things means that the spread of this virus is going to slow down, or at least you can isolate some of it and protect people that need to be more protected, such as people who are in a higher risk category, if they're older than 60, if they have heart disease, lung disease, or a disease which compromises their immune system. So it's really not only protecting yourself, it's protecting other people, and that's through isolation and slowing down the spread. And let me say one more thing about, this is going to editorialize a little bit about the flu vaccine, but what happens if you get the flu and you're not vaccinated is that you can get seriously ill. That may mean hospitalization or ICU care or death. The less people get the flu, the more healthcare resources are available for people to get the coronavirus. So looking at the big picture, cutting down on flu makes sense as part of the strategy for being able to respond, not only as a local community, as a country, to the coronavirus, because we don't know what's around the corner. We don't know whether this is going to be months or more than a year. That's impossible to know at this point.
And I know there has been information out there in the public sphere. People are anticipating that this may go away with the warm weather, but since this is a new virus, we can't say that for sure. So right now, we are not planning ahead that this is not going to be around in June or July. We just don't know. And so I think it's important that people take this seriously, expect that it may be with us for a long time, and take those measures that David just mentioned. There are things that people can do to protect themselves.
Right.
And that's really important.
And information on both federal level and local and everything else is still coming out in regards to this and so on. How do people get information from the Board of Health?
Well, the first thing I would do would be visit the CDC website. It is pretty extensive, and sometimes it takes a while to figure out where the answer to your question is. but it's very, very good in terms of giving factual answers. They have a very good website. The Mass Department of Public Health really pretty much follows their recommendations, and they have more information about what's going on in the state. And our office, Board of Health, has a phone number, 278-8600, extension 8, and we would be glad to answer any questions. We also are trying to coordinate our messaging, and the way we respond to phone calls with the local VNA, with the Senior Center, with Tri-River Health Center, and eventually with Milford Hospital. So we're sort of on the same page in knowing what's going on in our local community.
And I would say, too, that we really have a stellar emergency response team that is, as Chief Montminy mentioned, all of our departments being led by Kristen Black, who's our health director. And so we are on this 24/7.
Great.
And as new information becomes available, we will make it available to the public.
Okay, thanks again for joining me.
Thanks for having
very
us.
informative program to get out to the community. And once again, if you have any questions or any ideas for the show, please contact me here at Uxbridge Community Television at bgiles@uxbridge-ma.gov. Thank you for watching. Have a great day.